Welcome, everybody. Thank you for coming.
Hello, everybody. Thank you for joining us today.
If you have a moment, let's just go ahead and put your name and your agency in the chat so we can see everyone who's here. This is actually the largest webinar we've ever hosted, so we're super excited about that. Tons of interest in the health analysis that we're doing.
I'm very excited to see so many programs here today.
I see we've got some folks from Tennessee and Californians in here. Still got a few people coming in. I think Missouri, South Carolina. And we've got some folks from Ohio here.
New Mexico.
Well, that's fantastic. So let's go ahead and get started.
All right. Well, thank you guys for joining us today. We are Peter and Madison with CCR Analytics. So, Peter, do you want to go ahead and introduce yourself?
Yeah, hi everybody. Thanks so much for joining us. I am one of the founders of CCR Analytics. We're about to have our 20th anniversary. We've been working with early Head Start, state preschool programs for almost 20 years now. We focus on providing data analytical support. We do a lot of parent surveys we've done hundreds of thousands of parent surveys with Head Start families. We do a lot of child assessment analysis. We've developed interactive dashboards to help folks bring together their child assessment, family assessment, attendance, class, and other data into an interactive dashboard. We're the analytical partners for the QI network to help folks kind of really move into those process improvement, to learn how to do that and to integrate the data analysis into that. So really, we've kind of brought all of that experience together in our CCR Health Insights. So very excited to introduce you guys to that and answer any questions that you may have.
Thank you. And I am Madison DeYoung. I am the project manager at CCR. I have been with CCR for 12 years. So lots of familiar faces in here, but lots of new faces. So thank you all for joining us today. We also are going to have a couple of special guest appearances today. Desiree is one of our data coaches through Early Intel that does the data coaching piece to the CCR Health Insights tool. And then we'll also hear from Karen, who is the Director of Quality Improvement and a current CCR Health Insights user. So like we mentioned earlier, we have a lot of programs registered for today's webinar. I know some are still joining us now, but lots of diverse programs here. We have over 90 different agencies registered, representing 26 different states and over 110,000 children served among them. So we're very excited to have you guys here and excited that you're excited about health data. So feel free to drop questions anytime during the webinar in the chat, and we will get to those at the end. So if anything comes up as we're rolling through here, drop it in the chat, or if you want to say them to the end, raise your hand, that works as well. So today we're going to go over a few things. We're going to look at challenges that programs are facing when it comes to their health data, what's possible with CCR Health Insights when it comes to using your health data in a functional way. We're going to explore some real examples of how Health Insights works. We'll look at a mock federal review with and without Health Insights, and we'll also hear from a program that's currently using CCR Health Insights. After that, we'll kind of explore what's next and what steps you guys can take if this is something that you're interested in implementing in your program. I know a lot of people are gearing up for the new program year, so it's the perfect time to kind of dig into that and see what that entails. So when we sent the registration link to you guys, we asked you what your biggest challenges were currently with your health data, and we got a lot of really interesting responses. So just to kind of summarize those responses, a lot of responses were based around data being unclear, what really matters, what data is needed, what reports should you be pulling when you're looking at your health data. A lot of folks were having a hard time just getting access to that data or figuring out tracking follow-ups for different screenings. We know you've got 45 and 90-day requirements, and it kind of feels like a revolving door of follow-ups that you need to be tracking all the time. Lots of concerns about the accuracy of your data and whether or not your data is complete and getting that paperwork in on time. So hearing kind of what other programs are struggling with, we're going to poll you guys for just a second, get you engaged a little bit, and ask you what of these data pain points really resonates with you. So if you can go ahead and answer this question for us really quickly.
This has already been one of the most interesting parts of this process is hearing from folks in terms of what are the challenges they're facing in this process. And we pay so much attention to that to try and make sure we're developing analyses that are really kind of value added to programs.
Yeah, thank you guys for actively participating in this poll.
Yeah, it looks like we've got most of the folks have responded to the poll. So I think just give folks another 20 seconds to respond to the poll, and then we can share the results with everybody. We can kind of take a look at what people are thinking. All right, let's share those results.
All right, so it looks like the majority have concerns about the accuracy and incomplete health data, with a close second on tracking follow-ups under strict guidelines. Very cool. Curious to know what the something else's are. Anybody that responded with something else want to drop their something else in the chat for us?
Yeah, the accuracy and the incomplete health data is super revealing too. That is definitely something when we've talked to programs about signing up, they're kind of already worried about the accuracy of the data. And that's definitely one of the things we can focus on and look at both in the dashboard and in the coaching supports that we provide.
Absolutely. So next we're going to do something a little fun. We're going to have a little mock federal review. Desiree is one of the data coaches, like I mentioned earlier. I'm sure many of you have heard her speak before, but she's going to do a mock review with me as a health manager while I play the role of a federal reviewer. And you guys can kind of see what a typical federal review health data tour conversation looks like without CCR Health Insights.
I'm Desiree Delzio, and I have been working with Head Start programs, state and federally funded programs, for 20 years, and then spent 6 years with central office on the federal monitoring contract as a full-time employee. I led teams of federal monitors, and during that time I spent a lot of my energy learning the standards, working with the Office of Head Start, and really understanding what the expectations are for programs in the delivery of service.
Hi, Desiree. Welcome to our health data tour. Why don't you tell me a little bit about your progress towards health status determination?
So when I'm checking those things, I usually use my ChildPlus report 3015. I'm actually going to pull that up and share it with you. When I'm looking at the programmatic level, I go the last page of this report because it gives me my high level numbers. So here I can immediately see that of my 609 families that are enrolled in the program, that 98 of them have not met their health status determination.
Tell me a little bit about what you've learned about those families that are not getting it done.
Well, how we use the report, I guess I should say, to learn is that we go through it and we actually look for each of the families that has like a past due status, and that will tell us who those 98 children are. And then once I know exactly who those 98 children are, then I typically start emailing or calling the folks that work with those families, and just send them an update. That's basically how we use this report to learn and to respond to those families.
Okay, and have you noticed any trends with those families?
Well, I guess the biggest trend is that they just haven't done it. I mean, that's what we've noticed, is that it's just not getting done. Important about what we just observed is that this is a very typical response during a federal review when we're looking at health status determinations. Programs are very likely to give us the numbers. Here's the ones that are met. Here's the ones that are not met. And then when we start to get into using that data to inform change or to improve program outcomes, that's when we typically get these kinds of individualized approaches. Like we send out reminders, we talk to those families, we upload all of that into the system to prove we talked to them. But what we're not hearing oftentimes, and what we didn't hear in this sample, is the trend. What federal reviewers are listening for is data-informed trends that support the program and understanding how to mitigate or eliminate this challenge this year and in future years.
Well, thank you, Madison and Desiree, our amazing actors. We got one of the things we were trying to highlight there was that one of the biggest issues that Desiree has told us from her days as a federal reviewer and that we've seen in Head Start programs is really moving from using data in a case management perspective where we're sort of looking at the kids on an individual basis, which is an important way to certainly use your data, but looking at it in a more systemic way and really digging into the trends and figuring out how to use that data to drive that continuous process improvement. And what we see with a lot of the ChildPlus reports is that there's a ton of reports and lists and things that you can pull out of the report, but it's quite challenging to use that data and bring that into some nice visualizations that help you understand what's happening in the program and what's happening with your data. So that's sort of where CCR Health Insights comes into play, is we can pull your data from systems like ChildPlus and pull it in to complement the management systems like ChildPlus and really help you tease out all of the data that's in there in a more sustainable way, but also to make it ready for easy to present to other folks and keep you in that state of perpetual readiness for federal reviews. Been surprised by how many of our clients have actually had surprise reviews this year. They've been very aggressive. So let's switch our review here. And now we're going to do another mock review. Madison and Desiree are going to do another mock review for us. And we're going to look at the types of things you might be able to talk about when you do have CCR Health Insights and you're dealing with a federal reviewer.
Desiree, welcome to our health data tour. We're going to take some time today to look at your health systems and your health data. So tell me a little bit about your progress towards health status determination.
One of the tools that I use is my ChildPlus 3015 report. It's a report that shows me the number of participants in my program, and then the number of families who this requirement of health status determination is not met.
Tell me a little bit more about what you've learned about these families.
Yes. So first and foremost, we're always looking at who they are, what communities do they live in, what sort of things are going on that could be potential barriers for these 98 families. We really want to be responsive to that. But in recent years, we've started looking even more deeply within our program when it comes to responsiveness to health status determination. We've actually started disaggregating our data based on program option. And it's been really interesting to look at our data in this way. So here you can see that we're looking at our health status completion rates based on early Head Start center-based, early Head Start home-based, et cetera. And here we're really seeing that our greatest challenge in getting this met is with our family childcare homes.
And what trends are you seeing in those family childcare homes?
So we thought this was really interesting that we were doing fairly well in receiving our health status determinations. And we would consider this to be pretty strong at an 89 or above % rate, but that our family childcare homes were really holding our outcomes lower than we would have liked to have seen them. So we started interviewing our family childcare providers, not to ask them, why aren't you doing this? But really tell us what you know about health status determination. Tell us a little bit about how you introduce that to families. And what we found was that these Head Start families were so complex and had so much requirements that we found that they really didn't have the language or the understanding about what those expectations are to really help them and their families to be successful. So we've been very responsive this year to that by assigning them health aides to support them. So we've seen a real increase in their capacity to have that dialogue. So this year we're tracking much more intentionally around program option so we can see if some of these efforts have brought about the outcomes that we're looking for. But so far it's been very positive. Really important in terms of like really looking at the juxtaposition of these two dialogues is the first one that we did was very much on the individual level. Like we're looking at each of these families, we're telling them what they need to get done, we're giving them information, but we're not necessarily understanding the why behind our outcomes. And in that second discussion, and this is really what reviewers are listening for, this is really what the performance standards require of us, is that we are looking at our data in a comparative way. We're actually going in and pulling the data apart, and we're looking at it based on a number of different factors that might be influencing these outcomes. I think what was really powerful in this example is that the health manager is actually trying to understand why the struggle is happening and recognizing that the family child care provider didn't have what they needed to be successful here, and that it was our responsibility as the grantee to address that problem and to really remedy them. And so the interviews and the discussions and the support systems and the resources that we provided was going to be the thing that permanently corrected this challenge.
So hopefully that gives you a flavor of what we're going for in with the CCR Health Insights. And Desiree has been a great asset to us. She's a data coach with our partners Early Intel, and so is one of the people who serves as a data coach for folks who are using CCR Health Insights. I do want to take a quick look at the dashboard itself. Just to give you a little tour of the interactive dashboard that'll be available to you when you use CCR Health Insights. So you can see we've got data in here on the completion of the health requirements. And then on the right, we've also got data on the outcomes or results of those health requirements kind of once they're completed. So a couple different ways to sort of dig into the data, but let's start with a question that's pretty typical that most programs are asking when they come into the dashboard, which is, how are we doing in terms of just completing the health requirements? And so we can see all of our health requirements across the horizontal axis here, and the percentage of kids that have completed or not completed these on my vertical axis. And you can quickly see that 42% of my kids, only 42% of my kids have a timely completion of dental exams. And even if I include my late completions and my not dues, I've still got 26% of my children that are past due on dental exams. And so I've got a pretty clear gap here. The real question is, what's driving that gap? And this is where most reporting stops and doesn't help you get into the why or where these things are happening. So one of the big innovations here with CCR Health Insights is this group differences page. And here we're not looking so much at overall completion rates, but we're looking at how much those completion rates vary within different groups of kids. So I've got all sorts of different groups of kids here, attendance category or ethnicity and language. And then I can see for each of these health outcomes, how big is the difference within that group? And one of the interesting things that you see in this particular case is that for a lot of the demographic or sort of child or family characteristics, we see very little variation. So between different ethnicity and language groups, I see very small variations or negligible variations in the completion rates by health requirement. The same with family composition, gender, IEP status, whether they're English speakers or non-English speakers. But when I look at some of these more program structural things like program option, region, or site, I do see that I've got larger differences between the groups of kids within those comparisons. So, looking at dental exam sites is one of the large areas where I see big differences. So we can quickly dig into that. So now I'm looking at the differences in completion in dental exams. So you can see down here on my horizontal axis, I'm just looking at dental exams now. And I'm comparing my different sites in terms of the percentage of children who have completed dental exams. And there's pretty striking differences here. I've got one site where I've only got 23% of kids with timely completion and another site where I've got 83% of kids. So this is immediately pointing me to some bright spots in my programs where I seem to be doing a pretty good job in terms of completing dental exams, and then some locations where I've got some barriers or issues that I need to dig into. I can also look at this on a map. So here on this map, I'm looking at the percentage of children who are past due on their dental exam by zip code. So I can see in this particular case, I've got a cluster of zip codes here in the Southeast where I've got higher percentage of children who are past due. So I can kind of overlay what the geographic barriers or access to providers might be. And so typically what would then happen would be you would work with your data coach to help identify next steps in terms of like process mapping or empathy interviews to dig into that next layer, because to fully tell our data story, it's not just the quantitative data, but it's also that qualitative data of being able to bring in the information that we learned from and the example Desiree was giving, talking to our family service providers, talking to our health service workers, our families at the site level to have a better understanding of what's happening. So that's just a quick overview here of what our interactive dashboard looks like. But I don't want you to just hear it from me. I want to introduce you to Karen McFort. And Karen, if you can take yourself off mute. Karen was one of the agencies, was with one of the agencies that was part of our pilot and launching CCR Health Insights. And so she can give us some ideas about how this works in the real world. And Karen, can you just tell us a little bit about how you guys have used CCR Health Insights?
Yeah, absolutely. You actually covered a lot of it just going through the dashboard, but what we have found so helpful is in the past, before having access to this dashboard, especially with health data, we know, I don't know how many of you all use ChildPlus, but at least with ChildPlus, they have a great new feature, and it's the performance panel. But all of the health requirements are clumped into 30-day, 45-day, 90-day requirements. So we can break down those requirements by site, for example, but no other way. So not by number of years in program or, family composition or all those different attributes that are so helpful to see our data by. And in the past, when we do our annual planning, picking out what 3 to 5 goals we want to work on for the following year, we could see that high level data of, yes, we see that, we're only at 60% of our children having dental exams completed. But that's all it's telling us. So then we have to pull those reports and go, and take hours of time saying, okay, well, what's this site's percentage and what's this site's percentage? And then still we're only getting the breakdown by site and not all of those other attributes that can be so telling. So what the dashboard has done is given us so much quicker access to actionable insights. So instead of, and whenever we do quality improvement, we need to start with a root cause analysis. But in the past, when we don't have such good insights with our data, our root cause analysis is still so high level. We're seeing a whole number with, 6 to 10 sites of data altogether. So we just start with the why with everybody. Whereas when it breaks it down like this, we can say, oh, well, we see that this zip code is really struggling with dental exams. So we're going to target our sites in that zip code and do a root cause analysis there. So our improvements are much more focused and targeted and much more impactful. Because when you ask a whole group of people why something isn't right, then there's a lot more questions. Well, I thought my site's doing okay, and or I have, this reason, but then really we're not even needing to focus on your area because the data is telling us differently and we didn't even know that before. So it's been really, really helpful to allow us to have, again, targeted improvement efforts that are really making a difference.
Thank you. Thanks, Karen. I really appreciate that. And I appreciate all the feedback that you've given us to help us shape this into a useful tool.
Yeah.
So I, as you might guess, am a very detailed kind of person. And so I always want to know sort of, okay, what exactly is included when I'm getting CCR Health Insights? And so there are kind of really 3 pieces that you're getting. The first is the interactive dashboard, which we're updating with data from your management system from ChildPlus. And you can go into that anytime and play around. It's very interactive. The second piece is we pull together specific PowerPoint reports for you 3 times a year. And part of the reason we do this is that literally in the dashboard, there are 1,000 ways to look at your data. And so what we do is we have our coaches and our analysts kind of look at your data and pull out some of the pieces that we think are kind of most important. And what we include in those reports is also informed by the conversations that the data coach is having with you about what your priorities are and what's going on in your program, what your goals are, that sort of thing. And so 3 times a year, we'll kind of go through your data, pull out these reports, and then go over those with you. And the timing of those 3 reports is something that we'll discuss with you to figure out kind of when would be the most valuable time to pull that type of analysis. And then the thing that I think I'm most excited about is the coaching piece of this, is that we have you working with data coaches to not only just review those reports, make sure you're understanding the data, make sure that if there are any questions about the data, that we're able to kind of dig into those, that we're able to answer how to use the dashboard, but taking those next steps in terms of action planning, doing the next level digging on the qualitative side to figure out what's going on. And so those data coaches have been invaluable to folks who have been using CCR Health Insights. So really, when we pull this all together, this is kind of a culmination of all of the things that we've learned over the last 20 years in terms of how Head Start and early Head Start programs and state preschool programs use the data, and what are the supports that we need to kind of really help programs move into that continuous quality improvement space, and fully kind of take advantage of their data. And so it's that full combination of supports of the rich interactive data tools, the reporting, and the coaching that kind of all pull the pieces together. So I hope you'll take advantage of the supports that we can offer you guys. And the next step is we could send you guys a quote so that you guys can get that process started. Scan that QR code, that'll take you to a form to do that. Madison's also going to be dropping in the chat a link to that, so you can just link to that on your computer. But we're also happy to set up a demo for your team. If there's going to be a link in the chat there for you guys to schedule a demo, so we can kind of go through this with you and focus on your specific circumstances. We always have to kind of customize things to meet people's individual setups and needs. We spend a lot of time on that. So in the meantime, while you guys are kind of completing those, if you guys have any particular questions, please drop those in the chat. We're going to be going over folks' questions here. And I know probably one of the first questions we always get is, what does the cost look like? Depending on the size of the program, it's about $5,000 to $8,000 typically for CCR Health Insights. We know the budget constraints that your programs have. We work really hard to make sure that we provide as much value as possible for every dollar that you have to spend here. And so we've worked really hard to kind of keep those prices as manageable as possible.
Peter, we are getting some questions in the chat. The first one I think Karen might be able to chime in on as well because you mentioned it, but is the dashboard similar to the performance panel in ChildPlus?
Yeah, and I would say definitely not. And I do love the performance panel, so don't get me wrong, but it doesn't go down and it doesn't break the data down like with the Health Insights dashboard does. It doesn't break down the different health requirements. Like I said, they're all lumped together in 30, 45, 90-day requirements. So for example, like our 45-day requirements might have hearing and vision, health, oral, I don't even remember what all the ones are for 45 days. Sorry, my compliance brain has left me, but there's like several of them. So when you open it up, you can see it by sight, but you don't know which one it is. Are we struggling with hearing? Are we struggling with vision? What is it? We don't know until we pull those detailed reports and manually put that data into a usable form. So that's what the Health Insights dashboard is doing for us, is it's just making it so easy to break down our data in a usable way.
And, we work to try and make sure we're not replicating things that you can already get in ChildPlus, but that we're adding on to what ChildPlus can do for you and creating the new and additional value for you.
Another question that we're getting is how often is the dashboard updated?
Yeah, so we're updating it at least monthly, which we find is a pretty good time for a pretty good pace for being able to do these analyses. But we are working on some ways to update it even on a more recent basis, a more quickly basis, while also kind of keeping those costs down.
What is its applicability like for programs not using ChildPlus?
Yeah, for those programs, let's have a conversation about what tools you're using and what the structure of your data is. When it, we've always worked more as kind of an analytical service as opposed to like a software company, and so we're very flexible in being able to modify and adapt to individual trends. So, out to us and let's have a conversation about how you're collecting your data and what it looks like.
And then around the pricing, is that per year or a one-time?
Great question. Yeah, that is per year.
And that's also because every year you're getting the updates to the dashboard as well as the data coaching and the report deliverables. Is your program only related to health services? What about other service areas?
Yeah, that's a great question. So today we're focused on the health insights, but we do offer interactive dashboards that cover child assessments and family assessments and things like class data. So we have a lot of folks who use lots of dashboard features, and the Health Insights is just kind of an add-on to that. And we also partner with the Quality Improvement Network, which is a group of Head Start programs that share training and coaching and utilization of our dashboards to learn about and support their quality improvement programs. So there are definitely a lot of other things that we do, and we'd be happy to talk with you guys more fully about all of our services as well, if you wanted to schedule up a follow-up call with us.
We have another question. What if we find that our data is not set up correctly in ChildPlus? Is that something CCR can help resolve?
Yeah, and this is where the data coaches come in really handy, because we do find people who come to us and we're like, I mean, this sounds great, but I'm not very confident in my data. And we take a very continuous process improvement approach here, which is like, we start with wherever you're at. So if the process is we need to review and make changes to the setup in ChildPlus, the coaches can work with you guys to do that. We can use the dashboard to help identify where some of the issues might be in your data, and then the coaches can work with you around processes for improving that and monitoring that. And so sometimes, depending on where programs are, we're spending more time sort of looking at that data setup and collection process is kind of where we're starting with programs before we can get into maybe some of the more fun analysis.
Can we distinguish between Head Start requirements and state or local requirements?
Yeah, absolutely. And a lot of this is built on how you have your data set up. And so, assuming those are set up as kind of different events, we can pull, or we can show the reporting in a way that includes just the Head Start requirements or the local requirements. And as we're doing those reports, those PowerPoint reports a few times a year, your data coach will work to understand your program and how it makes sense to present the data for you. And so we can present those as kind of distinct things in that PowerPoint as well.
I just have a couple more here. What kind of coaching or support is included?
Yeah, so the coaching is set up with 6 or 7 coaching sessions over the course of the year, and we're tremendously flexible in terms of how that gets utilized, in terms of like reviewing those PowerPoints, putting those together, reviewing those, developing action plans, and following up on those. Um, and of course, if programs are interested in more coaching, they can always kind of scale that up. And so, but we wanted to include kind of a minimal amount of coaching in the package to make sure that folks are able to fully engage with the analysis that's being offered.
All right. And then what is required of staff for getting started?
Yeah, so getting started is pretty easy. If you're using ChildPlus, we would get a login to your ChildPlus system, which would allow us to see, first of all, how the health requirements are set up. So we would do a review of your health requirements to make sure we understand how your system is set up. And then we would have a kickoff meeting with the data coach where we would talk about the overall process, and make sure if we have any questions about how your health requirements are set up, because we've seen tremendous variety in how people set things up. And so we want to make sure we're understanding your data, and that we have a good coaching plan in place. And then after that, we're able to quickly start updating the dashboard and moving forward.
That was the last question we had.
Well, really appreciate everybody coming out today to hear about CCR Health Insights. If you've got any other questions, definitely feel free to drop those into the chat. And I hope you'll schedule some time with us to follow up and help us learn a little bit more about your program.
Yeah, thank you guys so much for joining us today. I did drop my email in the chat as well in case you have any additional questions that come up. Feel free to send them my way. And thanks again for joining us. Thanks, Karen, for hopping on and sharing with everybody as well.
We really,
Absolutely. Thank you.
really appreciate you, Karen.